Do you have any keywords or anything when they're looking at their local chiropractors, bios, or anything? What could or should they consider seeing that would show safety?
I hate this question.
Oh, I'm sorry.
I hate this question because I don't have wonderful answers. I have okay answers. So here are things to look for, particularly for hypermobile patients. It's a two-parter. Part
Okay.
one is look on their website for low force or no force techniques. There are a number, probably a dozen or more chiropractic techniques that are super gentle, that do not involve the cracking and popping movement, but that are really about a nervous system self-regulation. And so if you need help with that, that's the first thing to look for is low force and no force. And those exist. Not everybody advertises the kind of technique or force that they use. Although a lot of the people who do low force techniques capitalize on the fact in their advertising that like there's no popping and cracking here, because a lot of people are very nervous about the popping and cracking.
Mm-hmm.
The popping and cracking, by the way, is literally just gas getting released from joint capsules. It's a joint fart. It's cracking your knuckles. That's all it is. I also
Yeah, but when it comes from
when
the
somebody
neck,
does that
that's
in your
like,
neck, it can be really scary
yeah.
before I adjust people's necks for the first time, especially if I'm using those higher velocity forces. I say, I will set them up, I will get them really close to it, I will set them back down and say, this is the one that makes people the most nervous most of the time, especially if I get the impression that they are getting nervous about it. So I want you to know you're in good hands and you're safe. And I'm going to go as small as I can. There might be a noise. It might sting a little bit. It shouldn't really hurt. Okay. And then once they experience that that's what happens, it gets safer and easier. So for people who are hypermobile, that's the first really important thing is look for low to no force. And especially if you have a diagnosis like of Ehlers-Danlos, call them. Insist on speaking to the doctor, not to the front desk, and say, I would like you to tell me how much experience you have working with people with Ehlers-Danlos, for instance. And if they say, oh yeah, I see it all the time, it's no problem, I'm already nervous. But if they say, yeah, I've worked with several people, and when I do that, I completely adapt my technique around their connective tissue disorder, boom, great. Can I guarantee that anybody who says that is going to be able to do it well? No, you know,
But
but
it's a start.
there, there is no professional you can go to who simply by virtue of their title, you can count on being good. So, uh,
Exactly.
but that's a really good start. Other things to look for people who are not necessarily specifically hypermobile, but just want a chiropractor who sort of plays a similar kind of game that I do, does similar kinds of work. Look for trauma-informed on their website. If it doesn't say that, you can certainly call them and ask them what their experience or thoughts about working with trauma are. But I wouldn't know exactly what to tell you to listen for other than just like put your big listening ears on and listen between the lines.